Acute myeloid leukemia, AML, is a type of blood cancer that originates in the bone marrow, where blood cells are produced. In AML, the bone marrow produces an excessive number of immature white blood cells, myeloblasts, which interfere with the production of normal blood cells. While AML is more common in adults, it accounts for about 20% of childhood leukemias. Causes of AML in children. The exact cause of AML in children is not always clear, but several factors may contribute. 1. Genetic disorders. Down syndrome significantly increases the risk. Other genetic conditions like Li-Fraumeni syndrome or Fanconi anemia. 2. Environmental exposures. Exposure to high doses of radiation or chemotherapy. Exposure to benzene or other harmful chemicals. 3. Family history. A rare family history of leukemia may play a role. 4. Random mutations. Changes in DNA of bone marrow cells can occur without any identifiable cause. Symptoms of AML in children. Symptoms often develop quickly and may include 1. Fatigue or weakness due to anemia. 2. Frequent infections from low white blood cell counts. 3. Bruising or bleeding, e.g., nosebleeds, bleeding gums, due to low platelet counts. 4. Bone or joint pain. 5. Swollen lymph nodes, liver, or spleen. 6. Fever without an obvious infection. 7. Pale skin. Diagnosis of AML in children. Diagnosis is made through a combination of tests. 1. Blood tests. Complete blood count, CBC, to check for abnormal numbers of blood cells. Blood smear to detect immature or abnormal white blood cells. 2. Bone marrow biopsy. Confirms the presence of leukemic myeloblasts. 3. Cytogenetic and molecular testing. Identifies chromosomal abnormalities and genetic mutations. 4. Lumbar puncture. To check for leukemia cells in the cerebrospinal fluid. Treatment for AML in children. Treatment for pediatric AML is aggressive and requires a multidisciplinary approach. 1. Chemotherapy. 1. High-intensity chemotherapy is the primary treatment to destroy leukemic cells. 2. Induction therapy aims to achieve remission, followed by consolidation therapy to prevent relapse. 2. Targeted therapy. 1. Used for AML with specific genetic mutations, e.g., FLT3 inhibitors. 3. Stem cell transplantation. 1. Recommended for children at high risk of relapse. 2. Healthy stem cells are infused to restore normal blood cell production. 4. Clinical trials. 1. Children may benefit from experimental therapies under clinical trials. 5. Supportive care. 1. Transfusions, red blood cells and platelets, to manage symptoms. 2. Antibiotics and antifungals to prevent or treat infections. Prognosis for children with AML. The prognosis for children with AML varies based on several factors. 1. Age at diagnosis. 2. Genetic mutations and chromosomal abnormalities in the leukemic cells. 3. Response to initial treatment. The 5-year survival rate for children with AML is approximately 65 to 75%, but this depends on the child's specific case. Early diagnosis and advances in treatment have significantly improved outcomes. When to seek medical help. If your child experiences persistent symptoms like fatigue, unexplained bruising, or recurrent infections, consult a pediatrician immediately. Early diagnosis and treatment are crucial for better outcomes.